with what we're doing. We're going to check your blood, and you're due for the carbo and the paclitaxel today. And yeah, maybe one of these days we should do a bone marrow just to see where we are with things.
Okay.
And don't have you down for bortezomib today. Are you taking dexamethasone at home?
Yes.
Yeah, once a week?
Yes, before my visits.
Okay, that's good, because that's good treatment for the myeloma.
Okay. I'll definitely do that.
Yeah, that's good. Okay. Alrighty.
Now, on the 20th,
Yeah.
is when we're seeing Dr. Ahmed.
Okay.
And the 21st, I see you.
Yeah.
And we have to send instructions to AIC for my gamma globulin
Okay, sure.
for our infusion for the 22nd.
Okay, so let me put that down here.
Is Dr. Ahmed going to be upset if I tell her I want to wait a little bit on the surgery?
She's a very nice lady.
Till we clear up maybe a little bit more of the cancer?
She's a nice lady. She won't be upset. It'll be good to hear her explanation of why she wants to do the.
I think it's like standard procedure with her.
Well,
It's the course of action that's usually taken.
Yeah, it's the standard of care for treating ovarian cancer that show that patients do better if you could remove the primary. Okay. So we could, was the bone marrow okay for you? It wasn't too painful?
No?
Oh, okay. Yeah, usually I use plenty of anesthetic.
I remember wanting to go to sleep.
Yeah. Okay.
But that was after you were ready.
You and Candy left, and Barb stayed, and she held my hand during it, through it.
Yeah, you were in the hospital, and that's
Yeah.
when you were real sick already anyway.
Yeah.
Okay, and we'll give you the Velcade or bortezomib next week, and but we'll give you this bigger dose of the chemotherapy this week for the ovarian cancer.
So the 21st, you're going to give me Velcade?
Uh-huh.
That's the myeloma.
Yeah.
Yeah. And then the 22nd, you get the other medication from you get the immunoglobulin. Or is that right? Is that the right?
Could they give that to me too at the AIC center?
The Velcade?
Yeah.
Yeah, but I still want to see you and
Yeah.
see what's
Oh,
going
yeah.
on. Yeah. Okay. Yeah, we could do that.
And
I
yeah,
wasn't thinking on, I'm sorry.
Yeah.
The Velcade you could do. I was thinking of the Zometa.
Zometa, yeah, they can do that there. That's okay.
But I'm not due for that until when?
next week I think, because I think last week I said she's not due for another 2 weeks for it.
Yeah, you got it April 30th, so you're due May 28th.
Okay,
Okay,
so
somehow
after.
or other I got off. Well, let's just leave it as it is then, huh?
Okay.
Now, are we starting a new round?
Yeah.
And what does that mean? Is it a different dose or something?
No, it's a repetition.
Yeah, you get on day 1, you get the carboplatinum and the paclitaxel, and then on day 8 you just get the paclitaxel alone, and day 15 the paclitaxel alone. Okay.
And is it always the same amounts that she gets when she
we
gets
figure
it?
it out according to the patient's kidney function and according to their height and weight. So the height doesn't change, but the weight does, and the kidney function can as well. I'm just checking the dose here.
So basically, pretty much when she gets it, it's usually around the same thing each time.
Yeah.
Now, how long would we get the treatments?
Well, generally for the ovarian cancer, we give about 9 cycles and then stop. But we do employ the surgery sometimes, which can help reduce the amount of tumor that's there and help maintain the remission. Sometimes it's all gone except for at the primary site. They used to do second look operations to make sure that they got it, that it was all gone, and they might, at that time, cut out any residual disease, and it looks like it's swaying back that way again, which makes sense, because even if we can't cure everybody, if we could prolong the time without disease, that'd be good.
I was kind of considering, the surgery at some point, because the way it is now, like Sunday and Monday, I'm just out of it.
Yeah, no, I think it would be worthwhile, but you recover from the chemotherapy and then see how you do, if we could cut out a portion of it. So, well, let's get you going now.
We're starting the 3rd cycle.
Uh-huh.
And I think she wanted to do the surgery after the 3rd cycle.